Hello, viewers. We're about to discuss a sensitive topic. An expansion of aberrant brain cells is known as a brain tumor. There are various varieties of brain tumors. Some have no cancer, whereas others do. The size, location, and rate of growth of a brain tumor all influence its symptoms. However, there are a few common warning indicators you should be aware of. We'll discuss typical brain tumor symptoms in today's video so you can obtain the proper diagnosis and care. Do they include a headache? What about convulsions? We'll concentrate on all of this and more. Fatigue. A tumor's growth, development, and progression can seriously wear you down. You become quite weary as a result. The constant sense of being weak, slow, or heavy is known as fatigue. According to studies, 3 out of every 5 persons with brain tumors experience chronic fatigue. 1 in 4 people reported that weariness was a serious problem for them. But not everyone who has a brain tumor experiences weariness. People with all types of tumors may be affected. Everybody experiences fatigue differently. You might not experience the same problems as someone else who has the same diagnosis and course of therapy. Some people's weariness may be little. However, a number of people could characterize it as one of the strongest, most upsetting side effects you can experience. While weariness brought on by cancer is a topic that receives a lot of attention, persons with low-grade, non-cancerous brain tumors typically don't get much attention for their exhaustion. There are several degrees of fatigue. It occurs at entirely different times during the day and on various days. It may also interfere with your sleep schedule. This makes you feel so stressed out that you want to lose it. How do you manage tiredness? Changes in personality and mood. The answer to the question of whether brain tumors can result in personality changes and mood swings is yes. Similar to weariness, everyone's level of severity varies. It's fairly typical. Patients typically have trouble understanding other people and their emotions. Their actions can be deemed inappropriate at times. They seem to lack both discipline and a filter. On your brain, a tumor is pressing. Swelling may result from this. You'll immediately become aware of personality or mood changes. This symptom frequently occurs in conjunction with frontal or temporal lobe brain tumors. Headaches. A certain kind of tissue makes up the spherical that is your skull. The pressure inside the sphere increases if the tumor results in an increase in the amount of tissue. The skull is unable to enlarge to accommodate this. Headaches are a symptom of brain tumors, for this reason. At the time of diagnosis, 48% of patients with brain tumors report having headaches. They frequently accompany other neurological issues like seizures or speech difficulties. This results in the tumor's diagnosis. Every sufferer feels pain. However, headaches brought on by brain tumors appear to last forever. Midnight and early in the morning are terrible. Usually, they are described as dull, pressure-type headaches. However, some individuals do express pain that is acute or stabbing. Frightening? Yes. Headaches from tumors frequently have a geographic origin. Coughing, sneezing, or straining can only make it worse. Over-the-counter medicines can be used to treat a tumor headache. Looking for information on the most recent news in health and wellness? Click the subscribe button to become one of our millions of subscribers. Numbness and weakness. If you have a brain tumor, you'll feel feeble. It will almost seem as though you are powerless. You simply lack the energy. The cerebrum regulates how our body parts move or feel. You will experience a lack of strength and numbness if you have a cerebrum tumor in your head. Numbness and tingling in the face, arms, hands, legs, and feet are symptoms of brain tumors. We are all aware that our capacity to feel sensations throughout the body is significantly influenced by the brain. Signals from sensory receptors go through the neural network and are processed by the brain. This pathway will be blocked by a brain tumor, making you weaker. Tumor-related weakness and numbness typically only affect one side of the body. This symptom's location is determined by where the tumor is in your brain. It's scary and uncomfortable wherever it is. Are you attempting to improve your general health before we continue? You must, therefore, ensure that you are properly digesting your food. Watch this video to see 14 telltale symptoms that your gut is unhealthy. Returning to the warning indications of brain tumors. Seizures. Typically, seizures are regarded as the main clinical indicator of a brain tumor. Seizures affect 40 to 60% of persons with brain tumors. Patients with brain tumors experience at least 1 in 2 out of every 3 cases. Each person will experience the symptoms and severity differently. However, you won't experience the same problems as someone with a comparable diagnosis and course of therapy. When the brain experiences an aberrant surge of electrical activity, seizures occur. This throws off the routine that your brain follows and muddles all the signals. From this point, several symptoms will manifest. Seizures might only happen for a short while. They can occur both before and after surgery. If they do develop following surgery, it is as a result of brain swelling. Seizures are most common in those with low-grade or slow-developing malignancies. Seizures will also be one of the symptoms if your tumor is in one of the cerebral lobes. Nausea and diarrhea. Do you feel dizzy? Do you frequently pass out? There's a chance that you have a brain tumor. The pressure rises when a tumor gets bigger and occupies more area in the skull. Experiencing nausea and vomiting as a result of this increased pressure is possible. Hormone levels are also impacted by brain tumors. You're queasy after hearing this. When a tumor forms in a particular region of the brain, nausea and vomiting can also happen. A warning sign would be if the nausea persisted for longer than a week. Brain tumor-related nausea is typically worse in the morning. Additionally, lying down is not always a good idea. You may have a brain tumor if the quick shift in position causes you to feel queasy. Always keep an eye out for additional indications. Only nausea and vomiting are typically the only symptoms of a brain tumor. Depression. Everything in our life is hampered by depression. It can be seen prior to, during, or following the discovery of a brain tumor. According to research, more than 1 in every 4 brain tumor patients also has a severe depression illness. This also entails experiencing a sensation of helplessness. Like everything is breaking apart. You stop caring about things you used to enjoy. In addition to this, insomnia can result from depression. There are even suicidal ideas in extreme situations. Frontal lobe tumors are frequently linked to depression. Even though many of these symptoms are alarming, a brain tumor isn't usually the cause. Something else might be the case. For this reason, you should consult a physician and have a thorough evaluation. There are various additional methods for figuring out whether you have a brain tumor or not. What you should know is as follows. Check out these 10 indicators that you may have a brain tumor. You can also try these 6 meals to maintain brain function and keep your mind fresh. Go ahead, click one. Or better yet, watch both, and learn how to identify this illness at the right time. Have you, or anyone you know, experienced these symptoms? Let us know in the comments below.